Desert View Hospital has refurbished some rooms for the safety of psychiatric patients.
We've made the ceiling so that it's a solid ceiling. It doesn't have the ceiling tiles to where they could try to loop something around it to harm themselves. We've locked all the cabinets, taken everything out of the drawers. We remove everything from the rooms when the patients come in so that there's nothing in there that they can use to hurt themselves.
There was a need in the community as well as some of the state requirements. We retrofitted these two rooms to meet the requirements for what we call Legal 2000 holes, which is the designation here in the state of Nevada. Again, those that may have ideations to hurt themselves, these are very safe rooms. Now they can be dealt with most professionally. We've also brought in and hired Dr. Remmert, who will come in and evaluate the patient for psychiatric needs.
The rooms can be used for regular and psychiatric patients. There is a process for handling people with possible mental health issues.
If they're determined to be a psychiatric patient, then they're first evaluated by the ER physician, and then we will call in our psychologist to evaluate them. And then he'll determine if they need to be sent into Las Vegas for inpatient care or if they can be followed up within the community in an outpatient basis.
The wait time for psychiatric patients to have a bed available in Las Vegas varies, so the rooms are convenient for temporary services for these patients.
We keep them in the ER because they need constant supervision. The rooms also have video cameras, so we can monitor the patients at the nurse's station so that there's always an eye on them.
CEO Kelly Adams is trying to improve Desert View Hospital to include more services.
We're recruiting physicians, and we just recruited a surgeon, and we'll be adding additional physicians here, and that will, precipitate, expanding more services to the hospital. The State Department of Health, as well as the rural office through the State of Nevada Health Department, have granted us, or will give us a grant for telemedicine. And so if our psychiatrist is not available, we can hook up with either UNLV or one of the hospitals in Las Vegas or UNR in Reno, that we can still get these consults.
Telemedicine is similar to video conferences where medical personnel can communicate among each other or inspect patients regardless of their physical location. This is Deanna O'Donnell for News 46.